Hello and welcome. I'm Dr. Adam Dorsey, a psychologist in Silicon Valley and the host of Super Psyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. Super Psyched is your tool to get more of what you want in your life and less of what you don't. Cancer, the C word, the disease that is so feared, people often whisper it in sentences. Yet, according to recent statistics, nearly 40% of us will be diagnosed with some form of cancer in our lifetimes. With numbers this high, it behooves us to know more about this feared disease. I was recently captivated by an article written by a colleague describing her own experience with cancer, and I asked her to talk about it on this podcast. Dr. Anna Locke is a psychologist in private practice, and she serves as the clinical director at Psychotherapy Networker. I'm so grateful to her for all she shared on this episode. Anna was diagnosed with cancer while she was the mom of a young child. She describes her experiences and identifies many of the services that are sorely lacking by the systems that treat people with cancer. She also offers insights and advice for people who are currently dealing with cancer or are in remission from it. Her insight is similarly valuable for those of us who love someone at any stage with the disease. So listen in as Anna and I talk about a psychologist's experience with cancer. Dr. Anna Locke, who has asked me to call her Anna, a hearty welcome to Super Psyched.
Thank you. Great to be here.
What an incredible story you have. Not the story you wanted, but it's a story you've got. And I'm guessing this has been so far removed that you've gone through experiences that are hard to describe to someone who hasn't been through it, let alone for you to find a lexicon for you to describe it to yourself.
Yes. There's not a book that you get on how to handle this. And it is really just a lived experience until it really starts to make sense.
Yeah. And you described such a phenomenon of watching TV with your husband, cuddling up, kind of feeling the lump as, coincidentally, Ellen Barkin was on the screen, having a similar experience. And you going through the stages of like, nah, that's not really happening. And I don't want to be a hypochondriac. And I'm just wondering, this may be an impossible question to ask, but have you identified in some ways stages that you've gone through for this massive experience that might be similar to what others have gone through?
Yeah, it's interesting because I'm a little more than 4 years out now, and it's continuing to evolve and continuing to have new sort of phases. And I would say the first phase that lasted probably a solid 6 to 8 months was just like absolute disconnect, dissociation. I might have been there, I might not have been there, but I just completely disconnected from my body. I think from the moment I felt the lump, I just kind of knew. I don't know how I knew, I just kind of knew. And I think until probably a year after treatment finished, I think I finally came back to myself, because I remember kind of having this like, whoa, what just happened kind of reaction. And then for years after that, I would stop myself sometimes and just be like, I had cancer. And it genuinely felt like a surprise. Like there was something that was disconnected in my brain between what had happened to that version of me and who came out the other side. Certainly who was there before, but who came out the other side seemed to almost not know this part of me that went through this, what honestly was a horrific experience. That might not be true for everyone who goes through treatment for cancer, but for me, it was particularly horrible.
And I would think exacerbating this experience is the idea that non-cancer survivors can't possibly understand, certainly not firsthand, what you are going through emotionally, physiologically, the whole gamut. Yeah. And I'm wondering if you were to impart some things to a non-cancer surviving muggle, let's just call us, what is it that we should know? What are some things, like if there's a leaflet, oh, there's someone who you care about who's going through this, what are some of the things that you would render?
I think that the first thing to know is that it is, even when it's an early stage, even when it is treatable, curable, it is a life-threatening illness. And when your life is threatened, it's traumatic. The person might look fine, they might be acting fine. And again, everybody's experience is different. What I think is most important to start with is do not assume what is happening for this person. Okay, because it just on a different level takes you to this place, but like existentially, I guess. The other thing is to really just take the person's lead and what they need, but don't stop asking what they need. Before, during, after treatment, the answer might always be, I don't know, or the answer might always be nothing, but still show up, because it's for the reasons you described, an almost unbearably lonely experience.
You know, what's so interesting is, as I'm listening to you, I'm drawing a strange parallel here. And that is, I've talked to various veterans from the military who have responded differently to the stimulus of thank you for your service. What we often say to people who serve. Some people are totally cool with it. Some would rather have their lead followed by, hey, what was it like for you? Yeah. And this kind of phenomenological question, really fancy way of saying getting into the other person's experience, is what I hear you advocating.
I do think for the situation you described with veterans, that's important. And I think in situations like this, with a life-threatening illness, it's the same, because you can't put a blanket statement on it, as well-meaning as it is, that you're so brave, you're so strong. And I make reference to this in my article. I didn't feel brave or strong. First of all, I felt disconnected. Second of all, I was so terrified. And so to be told that just felt so disingenuous. You might as well just told me that it was snowing outside. It wouldn't have made a difference. I have a very distinct memory. I went through chemo, and it was 4 rounds of what they call dose dense. So they hit you with a really strong dose. You get 2 weeks off in between, then they do it again. And I have this very distinct memory of standing in my dining room, and my parents had come to help out. And I was on so many steroids to help my body function that I couldn't sit down. Literally, my body would not let me sit down. I had so much jitteriness within me. And yet at the same time, I was so nauseous, so sick, and so exhausted that I just wanted to go to sleep. And it was like my body was being ripped in 2 different directions. And I just remember crying and saying to my dad, don't make me do this anymore. I don't want to keep doing this. And it was this terrifying experience. I wasn't brave. I wasn't strong. I was crying. And so when you hear those kinds of things from people, whether it's true or not, it just doesn't do anything. It's sort of a neutral thing to say, if not maybe a little bit annoying.
I can only imagine. And I would imagine that same person could have such different feelings throughout the course that they might need different things at different times. I've heard of well-intentioned people not bringing it up, well-intentioned people trying to make light of it with a joke, well-intentioned people saying something that they think will be powerful. And it's not a one-size-fits-all proposition, let alone for this person who's going through it at various stages. I think that many of us don't know what to say, how to engage. And I've even heard from many people who are grieving the loss of a loved one, it's not going to break my heart anymore if you bring it up. In fact, it'll break my heart all the more if you don't bring it up. And I'm wondering, how do we articulate the question? I know it's not a one-size-fits-all proposition, but at least for you, what would have been the right prompts to say, hey, how can I be with you at this moment?
I'm going to answer your question, but I'm going to throw out one more cautionary, please don't say this to people before I say what you can say. I just really feel the need to let people know not to say this. Regardless of whether or not you believe this, which is totally fine to believe, but just don't say that everything happens for a reason.
Oh, sorry.
Right?
Oh my God. I just had a visceral experience of my body just, whatever endogenous chemicals are running through them now, it's not good.
Yeah.
As you say that.
There's a book written about this, which it's like everything happens for a reason and like other dumb things people say. I forget what it is.
Totally. And I just want to be clear. I've said dumb things and I've not said dumb things by not saying anything. So I want to be clear. I'm just another card carrying idiot. So
likewise. Absolutely. I mean, we all are, right? Because we don't know what to say. But I will say that to me, at least, was not comforting. It felt a little bit somehow not blaming, but I don't know. It just didn't sit well. And then the experience of afterwards of, well, what's the reason? Because I still don't think I see it. I'm supposed to have this big revelation about my life now that I have survived cancer. Why did this happen to me? I don't see it. Where is it? Almost feels more defeating, more sort of like, what was the point kind of feel when you don't readily see it, which I did not. So that made it really hard. I'll tell you what, for me, was most helpful. I had a friend that would text me almost every day. And sometimes it was a silly little video that she made with her daughter. And sometimes it was, how are you? Or it could be anything, but it was just that showing up text. And I never heard from her so much before. I do not hear as much from her now, but during that time, she just knew that she just needed to show up, and she lives in a different state. She just knew. And something like that felt very comforting to me. And I didn't have to tell her, but I do think that's something that you can tell someone is like, just check in on me. Just send me a smiley face. Just let me know that you're there, that I'm not alone. And I think asking, what do you need from me right now? How can I best support you right now? But don't just ask it once and assume that's the answer. Continue to ask it and continue asking it much longer than you would think you would need to.
Outstanding. I'm so taken with what you said, and you're talking about what I consider perceived support. It's almost like when you're bench pressing your max and somebody says, come on, maybe even gently puts a finger under the barbell, which is exerting 0 poundage, but just the perception that this person is supporting you lets you get through the set. A smiley face, it's a tiny gesture of saying, love you, which opens things up. I'm wondering, would an open-ended question like an ongoing version of how can I be helpful type of question, is that an okay thing to ask?
For me, it was. And for others, I experienced this for a long time afterwards. Still experience this, I guess, given the way you and I met. I can't stop talking about it. I'm 4 years out and I could meet anybody, anywhere, at any time. And it's like, I just feel this need to want to talk about it. Grocery store, checking out, how's your day going? And already it's right on top of my mind. I think about it every second of every day still, every second of every day.
So give me the full on. They ask, how's your day going? Do you ever say to, pretty good for a cancer survivor, some theme or variation?
I would say, give me 1 minute and I'll get there. It can be anything just because it's right on top of my mind. So I'm associating it with everything. Someone has shaved their head because that's the style they want. And I'm thinking, are they going through what I went through? It could be something about my child and having a tough time or something. And then my brain goes back to every time he has a tough time. It's like, because he went through this with me. He was 3 at the time when I was going through treatment. It can literally be anything. And it's just so on top of my mind that the associations just happen. From what I understand in talking to other survivors, that is not a unique experience.
It's almost like I see it filmically when you're describing it. I almost want to see the movie of the way you saw the world before cancer and the way you see it now. And I think it'd be very informative because it has really informed the lenses through which you see the world now.
It really does. And in ways that I never could have imagined, in part because I was young at the time. I was 37, which is, in quotes, too young to have cancer, right? They weren't looking for it. I wasn't 40 yet. I wasn't getting my scans. I don't have a family history of it. They did assume I did and did genetic testing and it all came back negative. So this isn't something that I was thinking about. And then again, besides sort of going into this dark tunnel for about 6 months, except surviving, And then afterwards, sort of this like, who did that just happen to? It colors every single thing that happens in my day. I was walking my dog the other day, and this sounds like such a morbid thought, and you might want to say, why spend time thinking about that? Like, you're alive, you should be grateful. I was walking my dog, and for a solid minute, I was thinking what it must be like to have terminal cancer and to know that you have to say goodbye to your child, that I would have to say goodbye to my son. What would I do with my last day? How would I mentally approach my last day? What would that look like for him? Again, no real reason that thought came to mind. I was walking the dog, and yet there it was. It colors everything.
It's like an ongoing prompt. And I'm wondering, as a therapist, I'm guessing you have ways of seeing these components of the process, the need to talk about it, the fact that it shows up involuntarily, automatically. And I would imagine that the best way to dance with these things is with self-compassion and patience as they emerge. But I'm wondering, what are your thoughts on that?
It's interesting. So I have a couple of approaches to therapy that I use, acceptance and commitment therapy being one, which I think is particularly helpful for people who are going through life-threatening illness or survivors of life-threatening illness. It is self-compassion. It is being in the present. It is mindfulness. And I will tell you that there are times, more times than not, that my brain just says, nope. I know exactly what to do. I know exactly what to tell other people to do. But when I'm sitting in my pain and the reality of the fact that I had an aggressive form of breast cancer and that I went through extremely traumatic chemotherapy that really impacted my body, radiation, surgeries, all of those things, that when I sit there with the fear of that coming back again, you could not pay me to engage in self-compassion because it's just so consuming. So yes, as a therapist, that I believe that those things are helpful. And I will let you know when I feel strong enough that I can actually start using them.
And I just want to be clear, I didn't mean to ask a theme or a variation of, hey, you're going through something. Well, what would you say to your clients or your patients or however you depict them? Personally, I call them the people I see. But I personally cannot answer that question because if I could get outside myself, I would get outside myself. But when I'm in my own thing, I kind of describe myself as the hair club for men, a guy as it relates to anxiety. I don't just treat anxiety, I suffer from it very badly and I need my own help, but I can't just self-talk my way through it. I generally need a midwife, and that would be a therapist. So I'm a big fan of therapists seeking their own therapy. I want you to take us to one of the darkest places you described, and that is chemotherapy, losing your hair, puking, feeling so desolate, physiological pain that is so outrageous, it's hard to even imagine. How did you find hope? I know you were describing needing your father, that there were times when you didn't, and you didn't have hope, you had nope. It was like, nope, I'm done. But how did you do it? It sounds like one of the things you did was you were willing to rely on the kindness of people who love you.
Yeah. I was thinking about this prior to coming on, Adam, and I was aware that you have such a positive psychology influence in the way that you approach things and view the world. And I felt less than positive through a lot of this. I will tell you that my why was my son, because I refused to leave him at the age of 3. I said to my doctors, like, the most aggressive treatment that makes sense. And they have all these ways of calculating how effective certain treatments would be, how beneficial it'll be for your long-term recurrence expectancy and things like that. And I went for as much as made sense. So when they said chemo, I said, okay. And he was my why. And I don't regret it for a second. Now, the day-to-day of it, because again, I had a particularly difficult time with chemo. I was allergic to the first kind they tried to give me. So I had this terrible reaction. And then on top of it, they canceled the treatment for that day. And I had to wait another 2 weeks to start. And I was crying. I was like, you do not understand what it took for me to get here today. I'm getting my first dose. And they were like, no, you are not. And losing my hair, I didn't wait too long to deal with the clumps coming out. I cut it short. And then I finally shaved it. And I had really low blood pressure. I passed out in front of my son I was in the hospital for a couple of days because of it. There were just a series of things that did not go well. And the only thing I can describe of what allowed me to get back into my mother's car every time I had to go, every 2 weeks, and let her drive me back to this hospital and walk myself in there and sit down in the chair and give them access to my port was just like survival. I don't know what else it was. You either choose to survive or not. And I had chosen to survive. So you just do it. And it's almost mechanical, which is why I think I was probably dissociated for most of it.
So as you're talking about it, I believe Morita therapy from Japan is just like, I put one step in front of the other, even if I don't wait to feel inspired to do this. I just do this because I know this is where I need to go. And I want to be very clear. Yes, I have studied happiness and I am a positive psychologist, but not at the exclusion of being informed by existential psychotherapy, psychodynamic, and a host of others, and being able to tolerate the suck, to borrow from Sheryl Sandberg, who wrote Option B, which I think is a really great book. The last thing I would ever want to do is, in positive psychology itself, does not peddle this, but is to throw down some toxic positivity. There's no smiley face.
Yeah. I mean, I swear I have more positive things to say about like a couple years, but in the moment, and that's why I was feeling bad coming on. It's like, I got nothing good to say about this experience. I really don't.
Right. So this is freaking nihilistic, meaningless. And on some level, I'm guessing you kind of had to merge with that because that was what was showing up at the time.
Yeah. There's a quote, some genius therapist in our field of psychology says something along the lines of what people who experience trauma need in order for it not to turn into PTSD. Obviously, this person says it more eloquently, is they need an empathic witness. They need someone who sees you, validates your experience and your pain. And I'll tell you, I had incredible people with me. My best friend, who was the first person I called, left her vacation in the Outer Banks and drove to go to my first doctor's appointment with me. My parents moved into my house so that my husband could take care of my son and they could take me to my appointments. I had wonderful support. And yet, for someone to be an empathic witness, there has to be sort of that intentional trying to connect to your personal experience. And who wants to connect to this experience? You can't. You really can't. And so it becomes this very, very lonely, very isolating experience. And it's hard to get around that.
Somebody else, speaking of paraphrasing, said, thoughts and prayers are nice, but show up with a shovel.
I love it.
So I love that your parents showed up, said, listen, we're going to handle some of the heavy lifting over here so you don't need to think. One less thing for you to think about.
Yeah.
And having a witness, it sounds kind of like Janina Fisher, but I'm not sure who would say something like that, but so good. For me, having a witness, when I'm thinking about just my own sadnesses throughout life, that we're such social creatures.
Yeah.
We might be introverted, but having a witness, we need a witness and someone who is just with us. It's almost like we immediately imagine that the lifting is somehow dissipated between the parties rather than just us doing it alone.
And it's hard on the other side of it. I have since had a couple of clients who have experienced cancer or cancer scares. I have had a neighbor who was going through it. So I've seen other people through the other lens. And it's really, you can try to be there as much as you can. And yet it is such, I don't know why, but it is such an isolating, lonely experience. So I know how hard it is to really show up for someone in the right way. It's not possible. So you do the best that you can and you keep showing up, even if you feel like this cannot be helping this person. You keep showing up anyway.
Say more about pushing through the self-talk around like this cannot be helping the person, but you show up anyway.
I'm trying to think of a way to make sense of it. And I think what you said about us being social beings is a really good point. You think about Harlow, the one.
I always say it wrong. The monkey, but Marlowe, I think it's Harlow.
So, but think about that, right? The monkey chooses comfort, the soft, fake wire mother covered in cloth over the wire mother that can feed the monkey. And I think that really is at the core of why showing up, even if you feel like you're not helping, is in fact helpful, because we are social beings, and the threat of aloneness can be, literally existentially terrifying. So you show up anyway, and you keep asking, and you keep tolerating on your own that anxiety of, am I getting this right? Am I doing this wrong? Did I say something wrong? You're going to say something wrong. You're going to get it wrong. We all do when we try to support people when we haven't had that same lived experience, which is hard to have. So you show up anyway.
There's an old rabbinic tale of this guy showing up for synagogue, not being able to read, not knowing how to pray. And with the fact that the guy showed up, first of all, and showed up with so much integrity, honesty, vulnerability, and being real, like that was the best form of prayer, according to this tale. And you're basically saying, same thing, you might bungle it. You might have a Jim Carrey moment in Dumb and Dumber where you say something really just off. It's okay. It's a game of batting averages. The relationship will actually be stronger, even if you screw up, which you will. Just show up.
You just show up. And again, I cannot express this enough. You keep showing up long after you think the person needs you.
Boy, that's really useful. You made a decision, and I thought it was a great decision. I stand by your decision a cajillion% of sharing your photo with someone who's going through cancer in your own practice. This, I think, is something that, assuming we get clearance from the client, it's something we need to do. Can you describe what happened there? Because it was so moving.
What I describe is an experience of sitting with a young client, a young woman who finds out while we're already working together on something totally separate, finds out that she might have cancer, and then ultimately that she does have cancer, and that part of her treatment is going to involve chemo. Not all chemo will lead to you losing hair. She was informed that the type that she would have would. And as a woman in general, beauty standards, our vision of ourselves and what is beautiful, hair is involved in that. And the idea of losing it was really weighing on her, was really upsetting to her. And there's lots of things you can say as a therapist, as a friend, to sort of support someone through that. The most supportive thing I could say, or that I felt I could say or do in that moment, was to show her a picture of my bald head.
So great.
So that she could see not just that she was not alone, which was the most important point there, but also that it grows back, because I obsessively looked at pictures of Natalie Portman after she shaved her head for that one movie and watched as her hair grew back. And that was my comfort, that my hair was going to come back. It's that not being alone piece. I think that was the most important in making that decision. Was it the right decision? It felt like it to me. Other therapists have other perspectives.
I think it was the right decision, 1,000,000%. So I think that, to your point, first of all, we need to know that we're not alone. I think that aloneness, feeling so alone. I remember reading my cousin, third cousin, Evan. He was actually, believe it or not, in Sex and the City. He played the part of Harry, who was together with...
Yes.
He's a cancer survivor. And going to Sloan Kettering and tripping out that the world was still going on, in spite of the fact that he had suffered a tremendous calamity, in that he was in the midst of an existential crisis that could kill him at any moment. And meanwhile, the world just goes on. And just knowing that your therapist not only made it to the other side, but knows what you're going through as much as another person can, because you've been to that country. You may have seen a different part of that country, but you've been to the country. And you've had the paradigm shift.
Right.
You've crossed a Rubicon in your life that you can never go back to a place of never having experienced this.
Yeah.
And she now knows that.
Yeah. And it's hard to bring yourself into therapy like that and maintain that thin line of, is this about me? Is this about her? How do I keep it about her?
Right.
But still provide this extra support. It takes a lot to walk that line. And there was certainly a time when that was not something I could do. It took a couple of years, but I do think that is something that we need more of in our field. We need to share ourselves in ways that make sense to support our clients. And in times when it doesn't make sense, we need to be sharing with each other our own personal experiences, our own lived experiences. And that's something to give a shout out to Psychotherapy Networker, who I work for and who I wrote the article for. Their whole purpose, their whole mission is to help therapists grow and learn and develop through shared experience and stories shared by other therapists. And the reason I took the risk in writing about personal body parts and all this other thing for my place of employment was because I knew that if another therapist read this and they saw a client who was going through something like this, they would have just a little bit more insight into what it might be like for that person and be able to support them just a little bit better. So I really think we have to be sharing our stories with each other.
I do too. And I remember another shout out to Psychotherapy Networker. At one of the Psychotherapy Networker conferences, Ron Taffel described judicious, thoughtful, discerning self-disclosure, which flew in the face of the way I was trained. And it seems that one of the big questions is, can you still maintain a good, appropriate boundary and treat this individual? And is it going to be about you or about the other person? And the way you demonstrated, you didn't tell, you showed in your story that you'd consulted with colleagues and you consulted with your own therapist and you judiciously attended to this young woman. I thought it was fantastic. Yeah, I think that proper training and self-disclosure, because of course, too much self-disclosure and then the therapy becomes about the therapist.
Yeah, it's a very thin line. It is.
Yeah, I remember sitting with a therapist who broke down and started crying during our therapy session about his own father. And I realized this would probably be our last session. This was not somebody I thought who could hold me in the way that I needed from my own therapy. You described something so unbelievable, the falling off a cliff. It's like, hey, guess what? We've treated you. Now go out the door and live your life with no real proper education about what's next. Let's talk about, like, first of all, big ups to the fact that medicine has improved to the degree that you are now sitting with me. And on the other side, there are still some holes that need to be filled based on what you wrote. What are they?
Yes. I'm so glad you brought that up. That was quite a learning experience for me. The resources and the supports that I had, shout out to my oncology team at UNC Chapel Hill's Cancer Center. They were incredible. I felt so held during that entire experience. But once my treatment was over, they have to go and help someone else, as they should. And there's not a new team that you get handed off to. And so it does. It feels like you're kind of dropped. And there's not a real clear understanding of who's going to catch you or where you're going to fall, how hard you're going to fall. And it was really terrifying. I think what I have learned through this process is that there is not a lot built up for folks in survivorship. There is a ton while you're in treatment. There is so much less available to people once they have survived. And how do you live your life once you've survived? And I've heard this reflected from other people who have been treated at other places. And the longer I am away from this, I do see that there are things that are out there that people are trying and things that you're doing, but finding a therapist that specializes in this is really hard. Often there's psychiatrists that work in oncology that you can connect with, but finding a therapist, just totally different experience. Resources for afterwards of what to expect. As part of my treatment, I had my ovaries removed for hormone suppression purposes because my cancer was hormone positive. It fed off of cancer. So I went into early menopause, and nobody really explained to me the long-term ramifications of that. Sure, you'll go through menopause. The hot flashes will be like X, Y, and Z. Fine, that wasn't fun. But the other ways that this has impacted my life and my health continues to show up all these years later. And I wouldn't have done anything differently, but there certainly was no heads up about that. You want them to focus on saving your life, but afterwards, it felt like falling, is what I can say.
First of all, I'm so saddened that you had to go through that. And I'm just thinking about the meaning after the loss, that you've even identified it and put it out there in that article was so important.
Yeah.
And you could have held it. You didn't. And now it's out there. People are reading it. It is a phenomenal article. If you have somebody in your life who's going through cancer, this is absolutely a must read. It's instructive without being pedantic. You read it and it's so utterly human. The reader, after spending 10 minutes reading the article, is so much smarter. So I hope you do more of that, quite frankly, selfishly, of course. Are there any plans in the works to do other things?
And I think that this is part of my own journey. As I said, the ways that this has impacted my life continue to evolve even 4 years later. And as a therapist with this insight as a survivor, I do want to advocate more for mental health services for both during and after in some way, shape, or form, and finding the energy to do that while caring for my son and working and doing all these things has not been possible for me. But the opportunity to come and talk to you really felt like that opportunity to put this out there and help people connect more through my story and maybe be able to support their loved ones a little bit more. I want to continue to find ways that I can support the cancer community, the survivorship community. And I also have to recognize my own limits and what mentally I'm able to manage before diving back in to that world where there's still so much pain associated for me. So there's hope. I just don't know when.
I mean, my gosh, how poignant to hear you say that. As I kind of take in your post-cancer experience, there are phases, it sounds like, and there is a phase when you're able to write something like what you wrote, and there will be, you're listening to yourself to figure out when you'll be ready. And I think that's kind of reclaiming what was taken away from you in some way, and that is saying, I will determine the timing on some things.
Yes. And I think for those survivors out there, as well as those going through treatment, that is so important, that listening to yourself, because it is not a linear thing. It is not. From the time I started considering writing the article until I was actually able to put it on paper was a period of a couple of months. It was something that I had to really let myself tune into of when I was ready to do it. And fortunately, the editors and writers I work with at Networker were incredibly supportive and patient with me. And then there was a difference between when I wrote the article and when it came out, and certainly compared to now. And it, again, not linear. So really checking in with yourself. Where am I right now? What can I handle? Not just with regards to talking about my experience, sharing it with others, but just honestly with getting out of bed in the morning sometimes, with the amount of stress that you can handle on your day-to-day life. Really listening to yourself and listening to yourself much longer than you think you would need to.
Is there anything else that's been helpful to you in this process before I get to my final question?
I think opportunities like this to share my story, to not have it be an experience that happened in the past and therefore let's move on, but that it can be of value to others, is probably the closest I have gotten to making meaning out of this experience. And so I'm grateful to you for giving me this platform.
Oh my gosh, it was such a no-brainer and remains so. And I'm just so grateful to you for sharing. Well, here comes my miraculous last question. Anna, if you had the magical powers conferred upon you to give an insight or a skill actually to all people, what would that skill or insight be? And how do you imagine it would impact the lives of the individual as well as perhaps society at large?
At the end of the day, the most important thing is what we have already talked about, which is that we are social beings and we have to be there for each other. Even when it's hard, even when you don't know what you're doing, the way that we can all survive the hard things that go on in this world is by connecting. And so even when it does feel like you have to force yourself to dial the numbers or to put one foot in front of the other to go see someone, do it, because it does help carry the weight that we sometimes face in this world.
I love that. I'm thinking even about the fact that, and I hope I'm having the correct group of people, but I believe it's Mennonites live in close proximity, and apparently they sleep better on average.
I believe it.
Yeah. So I might have the wrong religious group, but I even heard a comedian say what we need is to live the way we did at, Sleepaway Summer Camp. And that, for the introverts, there's always a nice tree to read under if you don't want to engage.
Yes.
But just being in close proximity to each other and being able to eat together and be together throughout life. No one could possibly describe that in a more powerful way than you after what you've been through. So that weighs a lot. And I just want to thank you once again. This has been a blast talking with you about something really hard. And I'm positive my listeners are going to benefit from what you shared.
Well, again, thank you for having me and thank you for giving me this opportunity to share my story.
This is Dr. Adam Dorsey thanking you for listening to Super Psyched. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe